So my name is Tina and I work for Center for Multicultural Health. And my program is particularly concerned with African immigrants. Why we are meeting today is just to have a conversation and discussion on HIV/AIDS. What do you think of HIV in your community?
Number one is a killer disease, and the second, she thinks if somebody had HIV that they're not gonna live, they're not gonna survive, so they're gonna die.
They're gonna die.
Yeah.
Maybe 3 months, 4 months.
In 3 or 4 months? What did she say?
She said people live more than 3 months with HIV, so.
Yeah, it's a deadly killer.
You're from which community?
Kenya?
Kenya?
Yeah.
Okay. And you're from which community?
Salam alaikum.
From Ethiopia.
Ethiopia. Okay. You have any idea of what's going on?
No, we don't have any idea because we don't know who has it or not. Maybe that's why we don't know about it.
Okay. Do you know where people can go and get tested in your community for free, or do people go to their doctors to ask for that?
I don't know where they can go be tested for free. So I don't know. I would also want to know.
They said no, but she said that she talk to her doctor.
Do they think it's a problem in their community?
xanuunkan HIV laha inuu barbaleen wadanka macnaha Soomaalideena anaga community-ga dhexdiisa inuu wax dhib ku yahay xanuunkan iyo war maxaa ka aaminsantahay
حنون حنون
هو البلاد هو يا إنه مكان حسبي الله.
ما في
they are aware of it.
No good.
Okay.
1997, she knew there was a man who had that disease and he was really, really sick and he became thinner and thinner and thinner, the stage where he cannot even move.
Okay. Do they talk? Do they talk to their children, the young ones, about HIV, about where they will get tested? Do they talk to their husbands about it?
ciyaalkiina ma kala hadasheen xanuunka HIV-ga la dhaho waxyaabaha laga qaadi karo ama waxa sababa in xanuunkan dadku ku dhaco sidoo kale dadka la qabo xaasaska nimankii idin qaban ma kala hadasheen xanuunkan wax oo wada hadal
وعلى كلا هلا نمك وعلى لا هلا محام أنا كلا هدو تلا يقوم مسود دواني
What did she say?
Yeah,
Ben
she
Mansur.
said of course she has a conversation with her husband about HIV.
حتى أفريقيا هذا صدق بلاد مخنا 2000 وحدا هداب إلهي كله أجيب ناد بأوتنا أفريقيا ورجع ريدي أوتها لكن هذا ناد أوتنا كم يوصل دواني سبان ما شيء حرونا وشيء.
You know the thing about for us our men they tend to have more than one wife and she said that she have a conversation about her husband if he marry another woman he need to make sure that
Nin
he
ma
doesn't-
kula
he doesn't-
tashanay ahaan hada.
he doesn't mess around.
Hal ya laba kun oo ogyahay ninkaaga.
Is there anybody discussing HIV in your community?
Actually, most people don't discuss about HIV because like they think this is not right and you feel kind of ashamed. So the way you are saying, in case there could be such topics to discuss about it and to promote their awareness of it in public is the best thing, because most people would now maybe come forward to be able to face the facts, because HIV does not choose. It has not gender. It has no age. It can just attack anybody. So, actually, what I would say, not many people don't discuss about HIV. Actually.
Do you think there's something that maybe me and you can do something different?
Yeah, I think the advocacy.
Advocacy. So when will it start?
Yeah.
I know we're all busy doing our own things.
Well, I should think it will start just within the community, like even when we hold functions like even birthdays for children, parties like during times when you celebrate your country's big events, you know. So if somebody could be invited and talk about it, then people could be aware of it. That's a way of, you know.
Do you know what kind of relationships people have in your community?
There's a lot of extramarital affairs. People trying also to date and to get married. So, you know, they are having sexual relations before they are married. That's a fact. But I think the biggest problem is that not having an open discussion. So we appreciate what you're doing. So maybe because we have a health drive quite often, at least that one I know about with the Kenyan community. So it's a good way not just to do blood pressures and cholesterol, make it more a focus, make it a part of the whole thing. Yeah, like maybe part of your overall presentation, just mention that because it's becoming a bit of a problem, but nobody wants to talk about it. And that I think comes from where we come from, because where we come from, we also still don't talk about it very openly. So we are still the same people. So, but I think this is a good start. I think personally, I'm not, you know, I try to, if I have friends who are dating, I try to say, you know what, you gotta be careful. Myself, I'm single also, I try to be careful. That doesn't mean that I'm all, you know, we are all always successful. I think our objective usually is a good intention. Try and meet your soulmate or the one, but you know, it's not always guarantee that you will end up with someone who's infection free. It's not always guaranteed that you're not infected. So I think if we open these conversations and I can know my status, and maybe if I'm trying to date, maybe I have maybe if I'm negative or positive, I can be able to protect someone who else I'm trying to date, and that awareness makes me want to do the right thing.
This education should go also to men.
Exactly.
Like now, how the women are here, they should be also be involved. Or maybe you have another different meeting for men only. Yeah. Education for them is the best thing.
Yeah.
If you ask them to come for other meetings or other places like here, that's the best thing.
You know,
So they can be taught like that, and me, I know what you have taught me here. When we go and try and talk back at home, he has that, okay, it was good, oh, it's right. Okay, you have that conversation, he might ask the other women to come and talk.
but also women need to empower themselves.
Yeah.
If you don't empower you, if you don't feel like you have the right to speak up, man, they don't care. Really. I mean, he has the right to go and do whatever he wants because he feels that he had that power.
Yeah.
And as a human being, you're a woman. Even though you're a woman, you have the power. It's in you.
You can
And you
find
need
a
to
way.
exactly. You find a way to figure out and say, hey,
Yeah, you
I'm a
will.
woman. I know, but I have a right to protect myself. And that's